TnCare and the law, and we're talking to Dr. Larry Woods of Tennessee State University and an attorney in Nashville, Tennessee. And of course, Dr. Woods, over the last segment here, let's give you an opportunity to perhaps pull out your crystal ball and look into the future in terms of where do we go from here, dealing with the situation that we find ourselves in, dealing with TnCare.
As we were saying, it's critically important. People's lives, their health, their livelihood depends on the solution to this TnCare crisis. And there are several choices. Governor Bredesen's original proposal last year to solve the financial downfall of TnCare was to scale back the services, to cut the number of prescriptions enrollees on TnCare can get each month, with, of course, an appeal loophole for those that had a medical need for more prescriptions. His other proposal was to require some small amount of copays and other scaling back and cutting back in different areas to save money in TnCare. And the reason Governor Bredesen originally proposed it that way was if he could achieve those cutbacks he described, he could keep everybody presently on TnCare enrolled in the program. There'd be
even
enough
though they
money.
might not receive full benefits according to what they had received earlier, but they would still receive some benefits.
That's right. As Governor Bredesen described it, instead of having a Cadillac health care plan, they'd have a Chevrolet or Toyota health care plan.
But
they'd
they would still
get coverage, still get health care. It just wouldn't be quite as good as it had been in the past, and that would save hundreds of millions of dollars. Governor Bredesen was not able to implement that new proposal because there are certain court orders in the United States District Court, in federal court, that limit the governor's ability as to how he can change TnCare. And I'll talk more about those lawsuits in just a moment. There are other proposals, both by the TnCare lawsuit advocates and by other organizations and people interested and concerned about TnCare as to how to save money. For example, one proposal made by both Governor Bredesen and by the advocates is we need to use more generic drugs rather than brand name drugs. And that's a step in the right direction. The problem is, the financial problem is, changing automatically to generic drugs will only save us about $10 million. Now, that's a whole lot of money to me, but to TnCare it's a drop in the bucket. It just doesn't change anything enough to make a significant difference. We need to consider going to therapeutic equivalents and therapeutic alternatives. That could potentially save hundreds of millions of dollars, but it's still down the road a ways. It's not going to help us today. So there are various proposals that I hadn't even gotten into to save money here and there in TnCare, and the problem is if we did all of them and we're successful in all of them, it's not going to save enough money. So we're left with, we're going to have to cut the number of people on TnCare then. If the federal court orders stop us from implementing a scaling back where we can keep everybody, which is what we want, then the other alternative is we're going to have to drop some people from the program. So the current proposal is to drop 323,000 people from the program. Keep all the children, whether they're eligible for Medicaid, TnCare or not, we keep all the children, but we drop over 300,000 adults. We'd rather not do that, but financially, it's the only way to keep the program alive since the federal court orders don't allow us to do the original proposal. So let's talk about the federal court orders because they impact so seriously on what we're trying to do. There are a series of 3 or 4 federal court lawsuits in the Nashville federal courts. They're called the Rosen case and the Greer case and others, primarily Rosen and Greer are the ones most active right now. There's going to be a hearing shortly in the Rosen case about Governor Bredesen's present proposal to drop 300,000 people from the TnCare rolls. And whoever wins that hearing, the other side's going to appeal to the Federal Court of Appeals in Cincinnati. So in the next few months, maybe in the next year, everybody's hoping in the next few months, we'll know what the court says about whether people can be disenrolled. Or technically, more correctly, it's not whether we can disenroll people from TnCare, it's more what kind of hearing and notice and appeal do we have to give people who are going to be disenrolled. If the federal courts stop the governor from limiting the enrollment. Then we're back in the same problem again, $1 billion shortfall, and we've got to make it up. How do we do that? Ultimately, if the federal courts stop us completely in the Rosen case and others, then I hate to predict it, but probably what's coming is an end to TnCare, reverting back